Hi there. If you or a loved one is living with an autoimmune condition like rheumatoid arthritis, ulcerative colitis, or eczema, and traditional treatments haven't done the job, today's video is for you. Let's talk about Rinvoq, also known as upadacitinib, a once-daily oral medication that's transforming how we manage autoimmune and inflammatory diseases. Rinvoq is part of a newer class of medications called JAK inhibitors, short for Janus kinase inhibitors. But what exactly does that mean? Think of your immune system as a communication network. When it's working correctly, it sends out signals to protect your body. But in autoimmune diseases, that system goes into overdrive, attacking healthy tissues instead. JAKs, Janus kinases, are enzymes that help send those inflammatory signals inside your cells through a pathway called JAK-STAT. Rinvoq blocks these enzymes, like turning down the volume on the immune system's overreaction. This reduces inflammation, joint pain, and skin flares without shutting your immune system off entirely. Rinvoq is FDA approved for several autoimmune and inflammatory diseases, including rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, non-radiographic axial spondyloarthritis, atopic dermatitis, ulcerative colitis, Crohn's disease, and is even used off-label for psoriasis. Rinvoq is often recommended when older treatments, like anti-TNF medications such as Humira or Enbrel, haven't done enough. It might be the right next step if you've had an inadequate response to anti-TNFs, you prefer pills over injections, or your disease is aggressive and needs fast, targeted relief. Rinvoq is one of the most effective options available, especially when other therapies fall short. It reduces joint pain, swelling, and stiffness. It improves skin symptoms and energy. It often works within 2 to 4 weeks. It's a convenient once-daily oral tablet, and it helps restore daily function and quality of life. Like any potent medication, Rinvoq does come with potential side effects. Common side effects include colds or mild infections, nausea and headache, acne, and elevated cholesterol or liver enzymes. Serious but rare risks include infections like TB or pneumonia, blood clots or strokes, liver problems, certain cancers, and bowel perforations. Before starting Rinvoq, your healthcare provider will run important tests to ensure safety. These include TB screening, routine labs to monitor liver function, blood counts, and cholesterol, a review of your vaccination history, especially for shingles, and continued monitoring for infections, abdominal symptoms, or signs of clotting. Rinvoq might not be right for everyone. Avoid using it if you're pregnant or breastfeeding, you have a serious active infection, you've had stomach or bowel perforations, you're at high risk for heart disease or blood clots, or you haven't yet tried anti-TNF medications. Rinvoq is generally considered after trying those first-line biologic treatments. In summary, Rinvoq is a powerful, targeted therapy that can provide major relief from autoimmune symptoms, especially when other options haven't worked. With the right monitoring and patient selection, it can truly change lives. Thanks for tuning in. Ask your provider if Rinvoq might be right for your condition, and stay informed, stay empowered.